our next topic, which is the situation in India, and I say the awful experiences that they're now having. And I think with COVID, obviously, and I think it stands out more, doesn't it? We're more aware of it because the situation here has dramatically declined, but with vaccines and people social distancing and wearing masks or whatever, and a lot of people behaving in a way in which we're now seriously able to control COVID and make it now, much more manageable, minuscule compared to what it was in the UK, say 6 months ago, whatever. Whereas, so we can now look out somewhere else and we can notice how, the tragedy of what's taking place in their society. And how do you perceive it, Tom, in terms of, one, what they're experiencing, but two, what can the world do to help?
Yeah.
What should the world do to help?
I mean, what's unfolding in India is clearly a humanitarian tragedy of epic proportions. I think the numbers that have been officially reported by the Indian government are undoubtedly way less than the reality. There's a complete lack of testing and recording of deaths across the country, particularly in rural areas. And in Arundhati Roy's extraordinary, utterly heartbreaking article in The Guardian, she suggests that the actual death toll could be as much as 30 times. That would mean 10 million people may have died across India already, and they may be sometimes 6 to 8 weeks away from any sort of peak. So we're going to see daily, weekly death tolls that are just unforgivable, really. And I say unforgivable because what we're seeing across the world is the result of political choices and other factors like lack of access to healthcare, privatized healthcare systems, which India's mostly is, which Roy alludes to in her article, and extreme poverty, which contributes to these things. But it's fascinating to note that and it's really quite extraordinary how the pandemic, I kind of feel like the pandemic has shown the whole world a message about how our political leaders should and shouldn't act. And 4 of the top 5 death tolls in the world are places where very, very right-wing leaders have been elected. We had Trump in America, Bolsonaro in Brazil, Johnson in Britain, Modi in India. They're 4 of the 5 world's worst death rates, countries with the world's worst death rates. And countries right at the other end of the scale that have managed the pandemic extremely well, followed scientists, followed public health procedures for dealing with pandemics, and cared about people ahead of profit. Some of the Scandinavian countries, obviously New Zealand with Jacinda Ardern, where left-wing leaders have been elected. And it's just this extraordinary example the pandemic has given us of how right-wing politics is about profit over people and profit over lives, and left-wing politics is about what's good for people ahead of profit. And it's been extraordinary, really. Going back to India, I mean, it's just a horrific situation. It's good to hear that we're already committed to sending some aid. I hope, obviously, that countries across the world will join us in helping India, and of course all across the world where the pandemic is bad and new variants emerge, that can come back and bite us as a country. So we mustn't be insular. We can't be. We have to view this as a global problem and a cooperative issue that governments across the world coordinate and help each other to tackle this issue.
Yeah. No, I'm just sort of listening to you and taking it all in. I haven't read the Arundhati Roy's article in The Guardian, and those figures are, well, it's just just mind blowing in the nature of what those people must be experiencing. I mean, dying on the pavement because they haven't got the oxygen, literally dying on the pavement. But unfortunately, with a country like India, it's probably something that's more common, much more common than it should be than maybe Western countries, because we haven't, as we talk about this globalized society, but we haven't become an integrated planet, have we? If we were an integrated planet, we would be looking out for each other. It wouldn't matter what country you're from, our empathy levels wouldn't be different. But unfortunately, we become fractionalized. So it's like India. India is thousands of miles away. India is over there. But what we should be doing, and I think an MP actually made this point in the Commons yesterday, he said, if we have 3 times more vaccines than we need, then we need to be sending those vaccines to India. If we no longer need those ventilators, we should be sending them to India. We shouldn't be umming and ahhing, because one person's life is no more valuable than another person's life, and it doesn't matter whereabouts in the planet they are. And India at this point in time can be a classic example of how we can all unite and come together and create this integrated planet where wherever the need happens to be, we respond as quickly as we possibly can.
Yeah, absolutely. And it's extraordinary to note that India is one of the world's largest producers of pharmaceuticals, but also the COVID vaccines, and yet not able to provide them to their people. In Roy's article, it talks about how there's now a growing black market in oxygen tanks. Just a horrific notion. And that the rich and powerful are managing to pay fortunes for access to oxygen or access to a hospital bed or a doctor. And of course, the poor people aren't allowed that access. I wonder at what, years ago, I wondered at what point do we recognise that a capitalist system is killing us all. I have this thing that says capitalism. Eventually, capitalism kills everything. First, democracy and the truth, then people and a habitable planet. And all 4 of those things are happening now. And I think I used to think, at the point that oxygen and water are for sale, are commodities for sale, that's when maybe we'll realize that capitalism isn't the best system to sustain human life. Well, we now have oxygen for sale. And water has just been floated on the stock market in America. And of course, share prices rise when a commodity is scarce. So it's in the interests of shareholders and rich, powerful businesses, including companies like Nestle, to make water a scarcity so that they make more profit from their shares. What an awful situation we've got ourselves in as a human race.
Yeah, and just to finish off as well, unfortunately, India has become a factory-based power base for the West. So the plastic, the pharmaceuticals, and many other aspects of our day-to-day existence are constructed and created at very low cost, or relatively low cost, in India, and then they're brought over to the West, to the playground, to the luxury houses, for people to experience. Whereas you have 1.2 billion people living in India. Next door, you have 1.2 billion people living in China. You have between 1/4 and 1/3 of the whole population of the planet's population. And ultimately, they are creating for us to live in this relative luxury just a few thousand miles away. And it's tragic and it's so sad, and there's so much we can do about it. Well,
before we move on,
Jace,
could I just say a quick thing about foreign aid, because we wanted just to give a mention to that. Obviously, we've just taken a decision to cut our foreign aid budget, which obviously in my mind is very mean and insular. But there are a couple of things I wanted to mention on that. One is that people tend to view foreign aid as handouts for poorer countries. And when times are tough in our own country, people tend to be persuaded to say things like, well, we need to look after our own first, and you know, and not give, they view it as handouts, and not give these handouts. This is what the cut to foreign aid actually means. It's not handouts. It means what we're doing now is implementing an 80% cut to water and sanitation projects around the world during a global pandemic. It means a 95% cut to polio eradication that we were helping to fund, and a 50% cut to Yemen, a country that's suffering from bombing and bombardment of weapons from Saudi Arabia supplied by us, including school buses being targeted for being blown up. And we're cutting aid to the Yemen, suffering a terrible humanitarian disaster themselves for several years. We're cutting our aid there by 50%. So it's not handouts. Those are programs that really help people and eradicate illness, disease, poverty, and that we're cutting now. And also, I read a fascinating article years ago that said about how foreign aid actually helps to prevent countries around the world from falling into dictatorships and having military coups and oppressive military leaders who might then want to go to war with us. And the article said, if you take our top military experts and ask them if we should cut foreign aid, they would all say absolutely not, for security reasons. It helps to create security around the world, which helps with our own country's security. So foreign aid isn't exactly what the Maryland Express make it out to be.
No, and to finish off, the sad thing is, ironically as well, the very people who shout and scream about us cutting the need to cut foreign aid are also the ones who are promoting and saluting the amount of arms that we sell to these countries. So you mentioned Yemen. You know, we create this outrageous genocidal situation on the one hand, but you know, people who are saying no to foreign aid are supporting that because they're saying, oh, it brings in money to this country. And yet, I very much doubt in many of the cases of these people who celebrate it will actually see any of that money. The fact that it's morally unjustified and morally repugnant is almost a side issue here, because if they're arguing that it brings in money to this country, where's that money going? Because it's not coming to us. Okay, thank you, Tom. Well, hopefully the situation in India, as you say, the peak is probably not going to be for 4 to 6 weeks, but hopefully, you know, we can do something, and the American population in Europe can do something, and Australasia can do something to help alleviate the suffering of so many people.
Yeah.